Welcome to the Egg Whisperer Show, a podcast exclusively designed to create more reproductive health awareness and discuss your fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
Hi, everyone. Welcome to another episode of the Egg Whisperer Show. So the topic of tonight's show is decreased ovarian reserve, also known as DOR. What is it? So the first thing that a lot of people think of when they hear DOR, you look it up, is it actually means depleted ovarian reserve. And so that's why I'm talking about this tonight, because I want people to know that it doesn't mean depleted. It just means decrease. And there's actually a huge difference between the two. And the other thing people think of is that they need donor eggs when they reach this diagnosis or have it. So just to be kind of funny, I just want to show something. Teeth, right? Most of us have them. If not all of us have teeth. And that's why I'm bringing this up right now. Because DOR is something that we will all have. At some point in our lives, every single woman is going to have DOR. But the problem is that many women have DOR before they're actually done with their family. So what do you do if that happens to you? And that's what we're going to talk about tonight. And the other thing that I don't want anyone to deal with is this feeling that they're walking and walking and walking, and all of a sudden they're at this egg cliff. There's no such thing as an egg cliff. Eggs decrease over time. It doesn't just happen all of a sudden. I mean, that's why, let's just give an example, the average age of menopause is 52 approximately, and it's really hard to get pregnant in the 10 years leading up to that age. So before you face the egg cliff, I want you to know how to figure out where you are with your fertility. First of all, what are some things that can actually cause DOR or a decrease in ovarian reserve? Most of the time it's just genetics and how many eggs you're born with and simply age, okay? But smoking is actually one thing that could cause DOR. I guess she makes it kind of look glamorous, I should say. Not really. But from my standpoint, eggs and sperm exposed to cigarettes are basically being killed off. Cigarettes are egg killers and sperm killers to me. So if you were to, let's say, take the fluid around an egg from someone who's a smoker, that will actually give you fluid full of nicotine byproducts, and that's really bad for our DNA. So one of the best things that you can do is stop smoking. Avoid secondhand smoke to prevent DOR. This person looks like a shell of a person, right? That's one stressed out person, okay? It's not a person, obviously. But my point is that while there aren't that many studies that we can point to that allow us to quantify stress and the impact on our fertility, I do think that if there's one thing that you can do that's in your control, and that is reduce stress. At the end of the day, reducing stress doesn't mean that all of a sudden you'll get pregnant, but it might increase your chances just a little bit. So, diagnosis. How do you know if you have DOR? Well, I'm going to talk to you a little bit about how you test, okay? So, one of the first tests that you do is called the FSH level. FSH stands for follicle stimulating hormone. It's a hormone secreted by the brain, and it tells the ovaries to make eggs. Stimulate the follicles. Each follicle has an egg inside. If you were to just Google image menstrual hormones during the cycle, you'll actually see a nice chart that kind of shows you what FSH does over the cycle. So that's why we like to check it between cycle days 1 through 4. So if your period starts, the next day is considered day 2. If you're confused about what's cycle day 1 or 2 for you, just ask your doctor, and your doctor will guide you as to the best day to get your levels checked. So I hear patients say to me all the time, oh, my doctor said that I have the FSH level of a 25-year-old, but an estradiol wasn't checked, and an AMH wasn't checked, and an antral follicle count wasn't done. So I would really urge people out there when it comes to figuring out what's going on with you to make sure you get the full picture. And that includes the FSH, the estradiol, and we'll talk about the other aspects as well. So as you can see on this chart, your age and your FSH level kind of relate to your pregnancy rate. So the higher your FSH level, the lower your chances of pregnancy. This is actually the higher FSH level. So up here is the lower FSH level. So when you meet with a doctor, they'll actually be able to guide you as to what your FSH levels mean for you. And to have the diagnosis of DOR, most people agree that a level over 12 equals maybe having a lower amount of eggs. Remember, it's decreased, not depleted. I actually like to alert patients that maybe something's going on with their eggs when their FSH is 9 or above. I don't think that it's fair to tell someone that everything is great just because your FSH is less than 10. Certainly everything is great, but you want to make sure that people know the full picture of what their story is, especially if they want more than one child and they're planning their future family. So the other two things that we do is we look at ovaries. So we have a picture of an ovary right here. Each follicle has an egg inside. And so we can do a count called the antral follicle count. Very easy to do. You just count up the number of follicles, and each follicle should have an egg inside. So an antral follicle count of 15 or above tends to be a sign that a woman has really high fertility levels. But the level changes over time. Some studies show that over 6 months or so, that follicle count will actually go down. And a follicle count of 15 for a 30-year-old means different things than a follicle count of 15 for a 40-year-old or even a 45-year-old. So each egg has a percentage rate of being genetically viable. That rate is determined by your age. So if you're, let's say, 40, an egg has a 10% chance of being genetically viable. If you're 30, that egg has closer to a 50, if not more, chance of being genetically viable. So when you're facing some diagnosis that makes you feel like there's something wrong with you, before you internalize it and make yourself feel like you have levels tattooed on your forehead, realize that every pregnancy just takes one egg. And these diagnostic tools, they just give you an idea as to what treatment options you should consider for yourself. But none of the tests tell you you have bad eggs. You cannot get pregnant. And certainly real life experience and trying and actually seeing your eggs as embryos and then finding out how they look, certainly that's something that can offer you a lot more information. So the other thing about DOR is that it doesn't mean donor. And there's also no such thing as an egg donor emergency. Seriously. A lot of people think that you can't change the path to pregnancy unless you have really healthy ovaries. So let's just say you've tried 6 months and you've tried to be as aggressive as you possibly can be with the diagnosis of DOR. And then you sit down with your fertility doctor and you reevaluate and you say, you know what, I'm 37, I think I want to try 6 more months. Well, let's say now you're 38. Your chance with an egg donor is still going to be very good. And you don't need ovaries to carry a pregnancy. So the one thing I think that women with DOR worry about is that even if they change the path to pregnancy, they might have a lower chance. And that's not the case. So I'm going to tell you a story about Missy. Okay. So Missy, she started birth control pills at 17. She started birth control pills at 17 because she had irregular menstrual cycles. And then at 25, she went and got her boobs done. She went and got a boob job. And then what did she do? She went and she got married. So the funny thing is that at the altar, no one says, I can't wait to meet Dr. Amy. So let me go back and talk a little bit more about Missy, because this story is not about me, it's about Missy. So Missy got married, and after 1 year of trying, what did she do? She went and she got her levels checked. And what did she find out? What she found out was that she had the diagnosis of DOR, and now she's ready to be proactive about procreation. But I really want to change Missy's story. I want to back up and say, okay, look, where did we as a medical community fail Missy? Well, if she was on birth control pills from the time she was 17 until when she got married, there were so many opportunities for her to get her levels checked. So she's not feeling that she's standing right there at the egg cliff after 1 year of trying after marriage. When she went in for her medical procedure for a breast augmentation, again, another opportunity. People make arguments and say, well, egg freezing is so expensive. Well, I would argue that getting a breast aug is actually just as expensive. And young women find money to do that. And if family is important, then they may also want to consider egg freezing. But if we're not educating the public about how to check your levels and what they mean for you, how are you going to know what you need to be thinking about or doing? there's this idea that you should try for a year before you even start getting checked. But let's just talk about Missy and say that while that might work for a lot of people, I think that most women should consider getting their levels checked by the time they're 25. The best time to have a baby, according to scientists, is between 25 and 29 years of age. My patients are over the age of 39. So that's the average age of my patient. Certainly I have patients that are 25. I have patients that are 45, 49, 26. Everyone's story is different. But I want no one to be Missy. I want everyone to be Jenny. There's so many Jennys out there, and Jenny's getting her levels checked. Jenny's getting her levels checked at 25. Jenny is considering starting her family early so that she doesn't have to be Missy on the cliff. No. Okay? So I want everyone to do what they can to get ahead of infertility. So now let's say you have the diagnosis. Okay? So you have the diagnosis of DOR. Well, now what? So it seems like a lot of hocus pocus when I start to talk to patients about supplements. But I do think that there are some patients that actually respond to supplements better than others. And as far as which ones would or wouldn't, I don't really know why, let's say, someone would respond to a supplement like acai berry more than CoQ10. So what I want to do is go through just a list of the hocus pocus supplements that I recommend for my patients. And I tell this to everyone, just because I'm here talking to you on this show about supplements that I want you to use, it doesn't mean that these are right for you. You have to get your levels checked. You have to meet with your physician. You have to talk about the supplements that they recommend for you in your particular situation. This show is just for informational purposes only, so that everyone is like Jenny and no one's like Missy. Okay? So melatonin is actually a supplement that I recommend to patients. I tell patients to take 3 milligrams per night, but I ask patients to get 1 milligram tablets. And the reason is everyone emails me their dreams when they're really, really funky and weird, and I can only handle so many funky and weird dreams. So the goal is to take it at night only, and if you don't have any side effects, continue it. And it's a very potent antioxidant. And the thought is that in some studies, and we're actually going to post a really nice link right now to the studies that have been summarized in a really nice article about melatonin and how it might help. But when it comes to stuff like this, it's really hard to do a really large study and take two groups of people and say no melatonin for you and melatonin for you, and then follow them and then see what their pregnancy rates are. But I think this summarizes how it could possibly help by improving the mitochondrial DNA in the eggs, giving it more energy so that hopefully you'll have a higher implantation rate and pregnancy rate. So the other supplements out there are acai berry, and there was a nice study done through CCRM showing that the dose isn't, I don't think, in the study from my memory, but I tell patients to take approximately 1,000 milligrams 2 to 3 times a day, and that might also improve egg health. So the other things that have been studied are CoQ10 at a dose of close to 600 milligrams per day. Resveratrol, I also tell patients to take about 1,000 milligrams per day. And then the other one is turmeric. So turmeric is an anti-inflammatory supplement, and it may help for some patients. So again, before you start taking these things, be sure to talk to your personal physician about whether they're right for you, because only they know what your medical history is. And I wouldn't want you to start something just because you heard it here. And let's say, for example, you have really bad mood issues and you take melatonin and all of a sudden you're really depressed. So I don't want that to happen to anybody. So the other thing that I tell my patients to do who have DOR is take HGH. HGH is a drug of abuse of bodybuilders, and I wish that I could take it and then look like her. But no, that's not what it does for us. So while we're used to thinking of it as a drug taken by bodybuilders, I just know hearing about Lance Armstrong and famous baseball players, but what the studies have shown, and we'll also add the link right now into the Facebook Live show that we're doing, what the HGH studies have shown, and the difference is subtle in the patients who took it, but it actually may increase your pregnancy rates. So if you're facing a diagnosis where you're being told that you have a smaller amount of eggs than someone at your age who has a good chance for pregnancy, then I think that HGH is something to consider. So this is who I offer it to. I offer it to every one of my patients over the age of 40. I offer it to patients under 40 who've had one previous IVF cycle at least, who haven't been successful. And I offer it to every woman, regardless of age, with an elevated FSH level. And certainly I talk to all my patients about it, and if it seems like it makes sense for them, certainly I can add it to their protocol. But for the most part, I definitely recommend it to patients who have DOR. It doesn't come at a cheap price tag, unfortunately. A vial costs approximately $400, and when you're already spending a lot of money, that $400 can be a little bit much. So think through whether it's right for you before you order it. Okay, so what about some other treatments? So in the news recently, especially, is talk about 3-parent IVF being available. So 3-parent IVF is actually nothing new. It was legal and then became illegal. And now the doctor, and I don't like that they call him, what do they call him? Oh, I'm going to just change my slide here for a second. So this is what's been all the chatter, especially this last week, is about Dr. Zhang doing 3-parent IVF in Mexico. Go to Mexico for something that is illegal in the U.S.? Well, he actually might help patients have babies, but at what cost? No one wants to be the guinea pig, but what he's doing is definitely pushing the envelope. It sounds quite out there, 3-parent IVF. It sounds like a threesome, right, Paula?
It does.
It does.
Missy, Jenny,
and I don't know. Tom. Missy, Jenny, and Tom are going to make a baby. So with 3-parent IVF, you have a donor egg and you swap out the nucleus with, let's say, my egg. And then that gives my DNA energy to turn into a healthy pregnancy. So it's basically nucleus swapping, okay? So 3-parent IVF may actually be something that women with DOR who, let's say, have not had successful IVF cycles should consider. But right now, it is way too new for U.S. doctors to be sending their patients to Mexico for this treatment. I do, however, ask my patients if it's something that they're interested in to explore it, to talk to the doctor and see how it's done. Because I think when it comes to having a baby with your own eggs, you want to do everything you possibly can to see if it's something that you should be pursuing. But I would say most patients, especially with a $100,000 price tag, they're going to consider other ways of having a pregnancy. So the other thing a lot of people are talking about, and it's also been in the news, is platelet-rich plasma or ovarian rejuvenation. So it's basically where they take your own white blood cells and plasma and they inject it into your ovaries. It takes about 10 minutes or so. It's similar to doing an egg retrieval procedure where it's like an ultrasound while you're asleep, but rather than extracting eggs, they're just pushing a little bit of fluid into each ovary while you're asleep, and then you go home on your merry way, and hopefully that can help you regenerate eggs. Okay? So one of the biggest recommendations I can make for patients with DOR, and I tried to find a picture that reminded me of jackpot, and instead I found fireworks. But I think the most important thing when you have DOR is to find a doctor that believes in you, okay? So I believe in the fertility of every single person that walks through my door. It doesn't matter what your levels are. It doesn't matter what your FSH, your estradiol, your AMH, your antral follicle count. It doesn't matter what it is or what they are. So these are 2 embryos that turn into twins, and they came from 2 eggs. She only had 2 eggs, right? So she obviously had DOR because her antral follicle count was only 2. That's not my only story. The highest FSH level that I've ever seen turn into a healthy pregnancy is 80. I've certainly have had patients who are at the cusp of where their fertile window is almost closed, and I've, let's say, tried to retrieve an egg, didn't get an egg, tried to retrieve an egg, didn't get a healthy embryo, and then they were pregnant. So if you have this diagnosis, the best thing that you can do is, like I said, find a doctor that believes in you. So get your levels checked. It's the FSH, estradiol, AMH, the antral follicle count, and then ask why this is happening. There are fertility genetic tests that you can do, looking at Fragile X or your fertility genetic profile, so that you can understand more about what you should consider doing to have the family that you want and the family size that you want. So I'm going to turn to questions, see if anyone has any questions for me tonight. Paula, do we have anyone asking us questions?
We do not have anyone on the phone.
Okay.
And the guys on Facebook are quiet.
They're
today.
Quiet tonight?
Yes.
Well, that's not bad because I was almost choking on my water, so it's not such a bad thing.
We can give them a second to see if anybody pops in a question.
Okay.
How high is too high before start of a cycle in your experience?
So I've had so most of my patients do genetic testing of their embryos before transferring. And so when I say most, I'm seeing that probably about 95% of patients will do PGS. PGS stands for pre-implantation genetic screening. I talk about it as if it's the closest thing to a crystal ball, although murky, that you can get with IVF medicine. So I've done PGS in patients who've, let's say, had FSH levels in the cycle that I'm treating them as high as 30 and up. So I'm not extracting 10 to 15 eggs for these women. I'm extracting one egg, and I have achieved success in patients like that. However, going into something like that, I am preparing my patients for what most of the time will happen. So if your FSH level is over 12, the chance of getting a genetically normal embryo is really low, but you just don't know what you're going to get until you try. And I think it's really important to try to see if you can get a normal embryo. The other thing is that when you have DOR, and let's say you're 30 years old, there's no such thing as I have the eggs of a 50-year-old or I have the eggs of a 40-year-old, because I think having a younger age actually protects you. So having DOR, let's say 37 and up, is very, very normal. But having DOR, let's say 26, it's not that common. So if you have really high FSH levels and a low follicle count and you're, let's say, under 30, I actually think that your egg quality is going to be better than, let's say, someone, and it's not just me, I think most of us as fertility doctors would agree, that your eggs will actually be better quality than someone who has those levels at, let's say, 43. That's a good question. Any other questions?
Mm-hmm. Follow-up there is LUI versus IVF and chances of success for DOR.
Okay, so the question is whether IUI, I think that's what
IUI,
yes. or IVF for chances with DOR. So IUI is just basically a turkey baster, but a little bit thinner. And in my office, not as romantic as at home or in your kitchen with a turkey baster. Clearly, medicine is my forte and not being a comedian or acting. So, it's just hard when you're dealing with this kind of diagnosis and someone tells you your chances of pregnancy are, let's say, 5%, and you really want to be part of the 5% that's now 100% and pregnant. So the reason why I think patients with DOR should consider IVF as soon as they have the diagnosis is because IVF is the only thing that will give you the highest chance for pregnancy. So with IUI, your chance for pregnancy would be exceedingly low, but certainly I've had plenty of patients who've gotten pregnant either naturally or with IUI with the diagnosis of DOR. So the patients who obviously can't do IUI are patients with, let's say, blocked fallopian tubes or low sperm quality. So you want to be sure that your doctor isn't just thinking, oh, it's just the bad eggs and not paying attention to the sperm. So it's important to look at both things to improve sperm health at the same time as you're doing everything possible to improve your egg quality if you have the diagnosis of DOR. Well, thank you guys for joining us, and we look forward to seeing you next week on our next episode of the Egg Whisperer Show.
Thank you so much for listening and making the Egg Whisperer Show a part of your weekly routine. To find show notes and a full transcript for this episode, visit dramy.org and look under the blog tab. While you're there, you can find a link for the Egg Whisperer newsletter, which keeps you in the know about fertility news. You can also find Dr. Amy and the Egg Whisperer Show on YouTube, Instagram, or Facebook. If you'd like to learn even more, Dr. Amy offers classes at the Egg Whisperer School, eggwhispererschool.com, or you can request a consultation on dramy.org. Thank you so much for tuning in and for sharing the Egg Whisperer Show with others. Keep sparkling and have a great day.